online chat. I just got a message here. Continue. Or even a phone call. And there are some pros and cons to having therapy in this way. So, you know, it's certainly not the same, again, as being in person. And sometimes there are technical difficulties. So I encourage you to set reasonable expectations before going into it and decide if it's an appropriate option for you. It's certainly a good temporary option for many. So if you are thinking about teletherapy, I do encourage you to first reach out to your insurance companies. Many insurance companies before COVID would not cover teletherapy. But during this time, they are making exceptions, which is very encouraging and awesome. So, but just make sure you reach out to your insurance provider, because those bills can be hefty. So make sure you check first. If you don't have a mental health provider already, I do encourage you to look for somebody, maybe a rehabilitation psychologist, or just somebody that is familiar with brain injury. I think that often makes it a lot easier to relate and make sure you get you know, the best type of support that you need. You can try resources like Psychology Today, which is an online website. It allows you to search by area or city. And you can search by specific needs too. So if you're feeling anxious, you can look for a provider that specializes in anxiety that lives in Columbus, Ohio. Right. You can also reach out to your local university medical center. Oftentimes they have rehabilitation programs or just psychology programs that can direct you to an appropriate provider. And then something that's become really popular in the last couple of years that many people really enjoy are online teletherapy platforms like Talkspace and Able2. So many options. Okay. So another way to find emotional wellness during these times is to create a schedule. And for many people, this is initially kind of, you know, something they don't want to do because, you know, many people don't like to, you know, have kind of a regimented lifestyle. But by doing so, by creating a schedule, you give yourself a sense of control in a time where there's not a lot of control outside in the world right now. A schedule can also give you a sense of stability in this wild and unpredictable time. And so, you know, some things that you might add to your schedule could be something simple like making breakfast at 8 o'clock or, you know, watching the news at 2 o'clock. And for those of you who are capable, adding exercise into your schedule could be really useful. You know, filling up your schedule with activities also helps regulate sleep, which we'll also talk about later. Because if you haven't done a lot in the day, there's a really good chance you won't be very tired at the end of the day. So fill that schedule up. I'm just gonna check the time here. Okay. I don't have much time. I have 4 minutes. Is that...
You're fine. We'll get through. We'll get through the presentation.
Okay. Okay. So, you know, you can certainly use your phone and make sure reminders can be really helpful as well. So the last thing that we'll talk about, last component for emotional wellness that I will talk about anyways, is sleep. And it's important in so many ways. First, in terms of mental health, restorative sleep decreases irritability, moodiness, and disinhibition. And so most of you probably know what disinhibition is, but for those of you who don't, It's doing or saying things impulsively without thought. A good night's rest also improves cognitive functioning. So for many of you with brain injuries, this is particularly important, right? Because when we're well rested, your attention, memory, balance, problem solving, and speech will be at their optimal level of functioning. All right. Speeding along here. Okay. So there's a lot on this slide, and again, I'll make sure you guys get a copy of this. I'll run through some of the things that are on here. You know, trouble with sleep is a fairly common issue, but there are certainly some things you can do to increase the likelihood of you having a more restorative sleep. And by restorative, I mean when you wake up, you feel well rested and ready for the day. So one thing you can do is limit daytime naps to like 30 minutes, okay? Sometimes after a brain injury, you experience what's called neurofatigue. So you get a little more tired throughout the day. And so you will need to take some naps, but try and limit them to no more than 30 minutes, okay? You also want to avoid any stimulants like chocolate, coffee, because that can obviously keep you awake. We talked about exercise. You also want to steer clear of food that might be disruptive to your sleep. So eating greasy things, spicy things, citrus, that can cause indigestion, which can lead to heartburn. And if you've ever had that feeling, very uncomfortable, not conducive to restful sleep. So try not to eat those foods too close to bedtime, all right? Something else that's really, I'll just list a few more things. Something else that can be really helpful is develop a ritual of around sleep time. When we're little, we did this, right? We might have had story time, we put our pajamas on, and then when we became adults, we stopped doing this stuff. But this is something that's really easy, you know, we can do to help ease us into sleep time mode. So we can drink a warm cup of chamomile tea. We can take a warm bath, you know, maybe smell some lavender or read a book. Anything that's going to tell your body it's time to rest and help you feel more relaxed, okay? The last thing, because I don't want to run out of time, is, you know, we've all had this experience where we're laying in bed and, you know, we've laid there for 1 minute, 2 minute, 3 minute. We're watching the clock go on and on and on. We're still not falling asleep. If we start to feel like that after 20 minutes, just get up. Because the more we think about how we can't fall asleep, the more we won't be able to fall asleep. So if you are, again, 20 minutes or more, you can't sleep, get up, do something else, like read a book until you do feel tired, and then you can try again, all right? And so I have a few more other things that are on here, but again, you guys will get a copy of this. I don't want to run over, so I will, you know, there's another component, mindfulness, which of emotional wellness, and I will let Dr. Prakash speak about that. But thank you guys for your time.
Okay, thank you so much, Anthea. Like I said, if you have a question along the way, you're welcome to type it into the group chat, if you're able to do that. Otherwise, we'll move on to Dr. Prakash, and of course, we'll have a panel at the end so that there's time to answer those questions. So with that, I'll ask Dr. Prakash to go.
Thanks, Kedar. Anthea, can you close the screen share? Or can I do that? All right. Good evening, everyone. It's great to see all of you. My name is Ruchika Prakash, and I'm an associate professor of psychology at Ohio State University. Now, I have been practicing and doing research on the topic of mindfulness meditation for the better part of a decade. For the most part, I look at how mindfulness meditation impacts brain functioning, and my research is funded by the National Institutes of Health and the National Multiple Sclerosis Society to see how this technique can benefit cognitive as well as emotional health for older adults and for individuals with multiple sclerosis. Now, this pandemic that we find ourselves in really catapulted this thought process in me, where I have made all of my mindfulness materials freely available on a YouTube channel. And I have been, for the last 5 weeks, hosting live webinars on mindfulness meditation. So in just a few moments, I will explain what this mindfulness is all about. Everyone has been talking about it. Even before the pandemic started, we were hearing this word on mindfulness at all times, but especially since the pandemic has started, a lot of people have been interested in exploring mindfulness, especially for emotional benefits. So I'll explain the definition as well as what I really mean by this construct of mindfulness in a few moments. But so much of this work is about experiencing what mindfulness is. So what I'm going to do is I'm going to start with leading you all through a practice. So for those of you who have been laying down, here's an invitation. Let's come up and sit up on our chairs or couches or beds, wherever you find yourselves in. And we're going to lead through a practice. So to the extent that you're able to follow along with me, that would be great. So as I just mentioned, that we have about 20 to 30 minutes together. And sometimes the invitation is to not even think about what's going to happen in the future. What we're going to do here is just learn about being right here, right now in this moment. Because this moment is really all we have. What is past, and the moment that lies ahead of us, well, lies ahead of us. So this present moment really gives us an opportunity to discover and learn and develop this enhanced experience with ourselves and in our minds. Now, if you were to take my webinar series, you'll realize that I keep saying that this work is about this or that. And it's about a lot of things. But one of these things is self-awareness and personal insight, learning skills to help better support us in each moment of our lives. So let's start with a little exploration. I invite you to close your eyes and just take a nice full inhalation, rolling your shoulder blades up, 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 feeling the tension, and exhale and roll them back. A nice exhalation and a release. Let's repeat it one more time and on your own pace. Nice long inhalation, feeling the stretch, noticing the tension, and exhaling and just relaxing and settling in a little bit more. So what we're going to do is we are going to explore what it means to pay attention to our experience in this moment. So what is your experience in this moment? And what do I even mean by that question? What are you aware of in this moment? So what we will do is just do this internal exploration. So imagine as if you are holding a flashlight, and we're going to be shining that on different aspects of your experience and just following along as best as you can. So bring your attention to your body sitting here, whether it's on a chair, a couch, a bed, or the floor. Just feeling the weight of your body. Notice what it's like to bring attention to your body sitting here. Offering yourself a simple and kind attention. Inhabiting your body, if you will. What's it like to bring attention to your body? What do you notice? We're not looking for anything in particular, just noticing whatever is here to notice. Do you feel heaviness, lightness, warmth, coolness, or perhaps some tension? Just notice. Now bring that light of awareness to breathing. How do you know you're breathing? Where do you feel the breath moving in your body? What's it like to just watch and notice your body sitting here breathing? What sensations of breath do you notice? Simply noticing. Simply paying attention with the purpose of paying attention in this present moment. And next, we will move to awareness of any feelings or emotions. The topic for today's webinar. So as you scan your experience in this moment, are you aware of any particular feelings of, let's say, emotional ease, or maybe distress, any anxiety at all? Perhaps a feeling of happiness, or maybe sadness. For some of you, it may be hard to sense this, and for others, maybe not. Just noticing with a kind and compassionate attention what emotions are present for you. Another phenomena that is occurring to some degree in this moment is that your ears may be picking up or receiving sound. Sounds in the room, sounds outside the room, perhaps space between the sounds. What's it like to pay attention to sounds, to hear what is here to be heard in this moment? Your mind wanders off, no big deal. Just like you would pick up a puppy in training, bring it back from wherever it has wandered off, and bring it back to your thoughts, to our thinking mind. And as you observe your mind, what do you notice? Streams of thinking, thoughts coming and going, thoughts about what has come before or what is yet to come. Just noticing. What's it like to pay attention to the nature of the thinking mind? And in the final moments of this practice, let's just bring our attention back to the body as a whole, sitting here, breathing for another few moments. And just know that the mind does wander off. The mind likes to tell so many stories, no big deal. Whether it's 5 times or 5,000 times. The invitation is to, with kind and compassionate attention, pick it up and bring it back to your whole body breathing. And I'll share a little verse with you as you sit here, just being. The verse is called beginning to begin. Can we recognize that every now and then there comes an inner sense, a fleeting thought, a little yearning to live our lives differently? We don't know what this means or what it requires. We shake those notions off like a dog shakes off water and go about our busyness. But the longing continues. Who has time, you ask? Reorganize? To do what? To stop? To do nothing? To be quiet? What for? Our practical selves only know how to perfect, produce, perform, and fix. This at least you can see is useful. This has results. You want to believe in this way of perceiving. And for a little while, it seems to give us some sort of self-image. But the longing doesn't let us alone. It won't go away. You become even busier and perhaps take care of it. We numb ourselves with distractions, things to do, and soon maintain things to collect, experience, entertain. We can always think of more miles to run. And still, the little yearning continues. Could we sense that this longing is not lack, or something worse, some kind of fundamental fault in us? Can we receive it as an invitation, as a calling, a small voice inviting us home back to our truer self? This slight shift in thought can move mountains. It can let us begin to begin. And so in a moment, when you feel so inclined and assuming your eyes are closed, just opening your eyes and bringing in the light of the room. And I'm curious to see what showed up for you. What did you notice? What did you become aware of? So you can use the chat button and just type up a few phrases for what showed up for you as you engaged in this practice. Somebody noticed that their chair was wobbly. Or I guess since all of you can see that, it's Kedar. Another person noticed their presence in this very moment. Somebody became aware of sounds. Feeling breathing in my belly. Noticing the sense of smell. So all of these different experiences that show up for us, as soon as we just take a moment, stop and pause and notice what our experiences are. So many times we just get caught up in this vortex of thought processes and emotions, and one thought leads to an emotion and that leads to another sensation. And so much of mindfulness work is about parsing out all of these processes and really seeing how are we getting caught up in these cycles of anxiety or depression or sadness. So what I'll do now is to just transition. So first of all, thank you for sharing. I'll transition into kind of just a brief didactics on what is mindfulness. There's a lot of science behind mindfulness meditation, and a lot of that is being done here at Ohio State University. So first of all, just starting with the basic definition of mindfulness, So there are lots of different definitions, right? We also see TSA agents using mindfulness, and we can all attest to the fact that TSA agents and mindfulness just don't go together. But here is a definition by someone called John Kabat-Zinn, who is considered the founding figure for bringing a lot of these mindfulness-based traditions from the Eastern world to our Western society and packaging it in almost a secular and scientific way. So he defines mindfulness as paying attention on purpose, without judgment, in the present moment, and with a kind and compassionate awareness. And that's a mouthful. So let me just tease this apart for you. It really is this awareness that arises out of intentionally paying attention. So just this practice that you all engaged in, just this 10-minute practice that allowed you to cultivate present moment awareness, can be a powerful way of describing mindfulness. But anyone that has dealt with strong emotions, whether that's anxiety, whether that's just feeling overwhelmed, panic, or feelings of sadness and depression, know that it's not always easy to pay attention to what's showing up in the present moment. And so the other component of mindfulness is to do so in an open, kind, and discerning way. And when you put all of this together, there are really these three components of mindfulness. So it's paying attention, we just all experienced that, and it's the intention, right? We spend so much of our lives behaving and thinking in the opposite way. So mindfulness is a very intentional practice. You're purposefully committing to this. And at the fundamental level, what's really critical to mindfulness are these attitudinal foundations. And these attitudinal foundations that I'll speak to in just a moment, they really are the soil in which we cultivate our mindfulness practices. So especially when you're attending to the present moment and you're feeling anxious about it, or you're not feeling so good about it, we start judging ourselves. And so these attitudinal foundations are important to invoke as you engage in this work. So with mindfulness meditation, there are 9 pillars or 9 attitudinal foundations. 7 were the original ones, and these included non-judging, patience, beginner's mind, trust, non-striving, acceptance, letting go. And there are 2 others, generosity and gratitude, that have been recently added. In the interest of time, I won't have time to go over all of these attitudinal foundations, but I have videos describing each of these attitudinal foundations on my lab's YouTube channel. So if you're interested, I'll give you a link to that. But it's this idea that we spend so much of our times engaging in the exact opposite of this. We're constantly judging our experiences. I like this, I don't like this. Or you're judging other people. We're impatient. Beginner's mind, often we have something show up and we're like, been there, done that, I don't want to engage in it. Not trusting ourselves, constantly striving, not being able to let go, just holding our fists so tightly. And all of these attitudinal foundations really are an invitation to see, can we just begin to balance the beam? What kind of a life would it be for constantly engaging in the opposites of this? And I also can tell you, not all the time. I've been doing this work for 10 years, and you can't always be engaging in these. But the idea is just, can we tilt the balance beam? Can we just balance it out? So attitudinal foundations really are important for this definition of mindfulness. Now, there's a lot of research happening within mindfulness meditation. It's extensively being researched for various health outcomes. So depression and anxiety, there is strong evidence for this one program called mindfulness-based cognitive therapy to help with symptoms of depression and anxiety. Some of our work, which I'll tell you about in just a minute, we've done randomized control trials that suggest that mindfulness training can help reduce mind wandering, right? None of you are mind wandering. None of you are thinking about dinner plans or what you did in the morning. This is such an engaging presentation, but we know that we engage in mind wandering all the time. And mindfulness meditation can help with enhancing focus as well as increase mood. There's been research that shows that mindfulness training can help reduce loneliness, especially in older adults, and help reduce inflammation as well. Now, one of the models that I wanted to show you was this National Institutes of Health. So for us as researchers to be able to say, you know what, this intervention really works for these symptoms and for this population, we have to go through this stage model of the NIH, where we start with basic research and we go through all of these stages to really be able to causally say that mindfulness is what really helps benefit emotional awareness. I would say, especially being a mindfulness researcher, is that most of the studies are at stage 1 of mindfulness research. There are some stage 2 studies. In my lab, we're doing 2 stage 2 studies, one with older adults and one with MS patients. But much of the research within traumatic brain injury, I would say is at stage 1. So we need a lot more research within this area for us to be able to say conclusively that mindfulness meditation can help cognitive and affective health in individuals with TBI. So what I thought I would just briefly present on is our research that we got recently published on the effects of mindfulness meditation and how that can help individuals with multiple sclerosis. So in this study, we had about 60 participants and we randomized them into 3 groups. So one group did the mindfulness meditation, but you also want to be comparing the group that's doing actively something with another group that actively is doing something as well, right? Because if you're just comparing mindfulness with people who are not doing better, of course the mindfulness group is going to get better. So active control groups are really important. And our control group did something that a lot of people talk about all the time, cognitive training, right? How can it benefit cognition? I want to make sure I'm not going over too much of my time. I'm going to just wrap this up. So participants were randomized to these 3 groups. And what we found is these are studies that were literally published like 2 weeks ago. And OSU Research News did an article on this. And what we found was that MS individuals who participated in the mindfulness group showed what's called reduced emotion dysregulation. This emotion dysregulation, this is a factor, it's kind of like a transdiagnostic factor. So it underlies a number of psychiatric disorders, ranging all the way from anxiety disorders to mood disorders. So it was really exciting for us to be able to say that when you engage in mindfulness meditation, there's a reduction in emotion dysregulation. But the second finding, which was a little bit to our surprise, especially because we were comparing mindfulness with cognitive training, is that we found that in individuals with multiple sclerosis, people who participated in the mindfulness training group were the ones that showed increased cognitive functioning. And again, as a cognitive neuroscientist, that's something that's really exciting for us. And we expected both mindfulness and the cognitive training group to do similarly well, but it was a mindfulness group that did better than both the active control group as well as the passive control group. So just a brief snippet of some of the research that's going on here, and I'm happy to answer any questions on this. So here is, I do live webinars. We are in week 6. So this coming Wednesday, we're going to be in week 6 of mindfulness meditation. It's on Wednesdays from 12 p.m. to 1 p.m. US Eastern time zone. If you want to register, here is the link. And if you're not able to make it to the live webinars, this YouTube channel has all of our materials, including a few of the webinars. I'm terrible at recording these sessions because I always forget to record them. So we have some of these webinars that have been posted on this YouTube channel as well, and all of our meditative practices have been made available as well. So thank you for being curious, staying curious, and engaging with this work. I'm going to transfer it back to Anthea and Kedar, and would be happy to answer any questions that you have.
Thanks very much, Ruchika. That was really great. That was actually my first time doing a mindfulness activity. I take it back. I have done one with Dr. Wright before, but they are just very transformative. So what we'll do next, what I want to just do very briefly is have Dr. Wright introduce herself, and then we will open it up for questions. I, of course, have a stack of them, but you're very welcome to ask questions through the chat. And if that's hard for you to do, you can also just raise your hand physically. So give me one of these and I will unmute you in one by one, and we can ask those questions. So first, let's go to Dr. Wright to have her do a little introduction of who she is, how she approaches mindfulness, and in her research.
Hi, thank you so much for the introduction, and I'll just be very brief. I am a clinical nurse specialist by trade in psych mental health and geriatrics before I got my PhD, and my area of interest is working with older adults, particularly vulnerable older adults that are at risk for cognitive impairment. And I use mindfulness as a way to uh, help with thinking and focusing, as well as to help with self-care behaviors. So I look at mindfulness as sort of one of the tools that we have in our toolbox to keep us healthy. One thing that I like to do with people in regards to mindfulness is talk about diet and physical activity and eating. So especially during COVID, we've probably gotten into some different eating habits that maybe we're not as focused on our health, but mindfulness is a way that we can take a moment and actually sit quietly and enjoy our food or our meal. And I'll oftentimes do an exercise where we eat a piece of dark chocolate very slowly, not the usual way where we throw it in our mouth quickly, but to actually feel and sense what you're eating. And it helps to even keep you more full that way. So I will turn it over to the rest of the group. Thank you for inviting me.
Very good. Thank you, Dr. Wright. So again, if you have questions, you feel free to raise your hand or to type your question into the chat. Just to get the tone going, I have one question. So Dr. Gray, you talked a little bit about sleep practices, scheduling. There's a lot of different tactics for emotional wellness. And I'm curious for the whole panel, how do you feel that mindfulness really interacts with those other types of tactics? Can they be added together? Are there challenges or interesting opportunities to be able to put those things together? I'll leave that open. So maybe Dr. Gray, if you want to start with that, and then we can move around the panel.
Sure. So with mindfulness and with mindfulness and emotional wellness, emotional wellness is has a lot to do with mindfulness, and that you're thinking a lot about what's going on in the moment. You're thinking about your feelings. You're not thinking about tomorrow. You're not thinking about yesterday, and you're really focused in the moment. And so doing all that, I don't want to, maybe Dr. Prakash can talk about the potential benefits as it relates to sleep. She's probably more familiar with that literature than I am, but on a very superficial level, I can tell you that a daily mindfulness practice can certainly help you feel more centered, and help you have more restful, restorative sleep. And doing that alongside, creating a schedule and practicing those healthy sleep behaviors would definitely support your overall emotional wellness.
I think, Kira, the way you worded your question, that's really, the right way to be thinking about this as well, that all of these behaviors, and I like to call them lifestyle behaviors, so we do
Dr. Prakash, can you speak up a little bit? It's really hard to hear you.
Okay, can you hear me now?
Yes, perfect.
Okay. Yes, I was just saying that, you asked the question in the right way, because when we think about these behaviors, these are what I call lifestyle behaviors, and they're all so interrelated, right? Whether it's mindfulness, whether it's physical activity, whether it's lack of sedentary behavior, nutrition, as well as sleep. Last fall, I was in Singapore giving a talk at the International Mindfulness Conference. And one of the issues that people living in Singapore has, that across all of the countries in the world, Singaporeans get the least amount of sleep. And they've started seeing that that has been having an impact on their mental health. So there's a lot of research happening on what are the reasons for lack of sleep and how can we encourage people to engage in healthy sleeping behavior. And one of the interventions that they're funding, and it's a multi-million-dollar project that's going on at the National University of Singapore, is looking at the effects of mindfulness training on sleep outcomes across the entire developmental spectrum. When I was presenting the NIH stage model, I think the research is pretty equivocal right now. So some studies have found that mindfulness benefits sleep outcomes, but other studies have found that when you look at objective metrics of sleep through actigraphy, you don't see any benefits from mindfulness. But all of these have been really small pilot studies. So I think once we have these more longitudinal and well-powered studies, we're going to get better answers in terms of, does mindfulness training improve objective markers of sleep? But I think overall, they are very highly interrelated.
Dr. Wright, any thoughts on this?
I think that definitely practice makes perfect, and especially in relation to mindfulness. And I think the hardest part is getting into that routine of practice. So I think really forgiving yourself in terms of how many minutes you practice, even if it's 5 minutes a day or 10 minutes a day, or even every other day, but just to open yourself up to be able to begin that practice, I think is really critical and helpful.
Okay, thanks very much. So Michelle, I saw that you raised your hand, so please ask your question.
Yes, sure. Can you hear me?
Yes, we can.
Oh, great. My question is really for both, but I'm wondering if you've ever used mindfulness to help people with autoimmune diseases, because that really negatively affects cognitive function, the autoimmune diseases. Now, I have 5 along with my TBI, but I have found probably I use a different mechanism other than mindfulness, but it's more just stopping and thinking and maybe praying for something or someone. But it's probably very similar to mindfulness. But I've found that that helps me a lot. I was just curious if you've ever used it that way for autoimmune diseases or thought about it.
So my research is with, my voice is echoing. Is that good? Can you hear me?
I think you're good now.
Okay. So my research is with individuals with multiple sclerosis. That's the only autoimmune neurological disorder that I look at. And I just presented data on that suggested that mindfulness training helped reduce emotion dysregulation, but really improved cognitive functioning as well within this population. And like I said, we were quite surprised to find these results because we were comparing it against computerized brain training programs. And there's so much talk about computerized brain training. And what we found was that it was actually mindfulness meditation that improved cognitive functioning over the brain training. So but it's a pilot study. It was with only 60 people. We have a study that hopefully we're going to be starting soon with about 200 individuals, and it's going to be a completely internet-based mindfulness program, kind of similar to what we're doing here as well, so that we could reach a much broader population. And I think if we're able to replicate those effects, that's going to be much more conclusive evidence for that.
And I just wanted to add one thing too. There is one of the mindfulness meditations that we do. Sometimes it's called the loving kindness meditation, where you are thinking about others. And you had just mentioned too that part of your routine is thinking or praying for others too. So that might be a type of mindfulness meditation that may be appealing to you.
Okay, thanks very much. So next person up is Dimas. So let me unmute you here. There you go.
Oh, can everyone hear me?
Yes, we can.
All right. First off, just want to say it's a blessing to see everyone here. This isolation has been very tough, so I'm just thankful to see everyone. So God bless you all. I had a question about mindfulness. My first question is mindfulness a form of DBT? I'm not really quite sure what that abbreviation stands for. The D word is long, and I don't know how to pronounce it. But I know CBT is cognitive behavioral therapy. and I was referred by my neuropsychologist to partake in CBT after I did neuropsychological assessment. But one time I went to a agency or a place, and I partaked in DBT, and they actually taught us of mindfulness over there. And my first question, my question is which one would be more beneficial to a brain injury survivor? Would it be CBT or DBT, or are they even? And I basically just again just want to have a brief summary of what DBT is again, by somebody who knows exactly how they can explain it better. Just I like a lot of that talk and stuff like that. It was hard to understand that lingo. I'm still kind of confused about what it is. So I just wanted to have a little bit of a better explanation of it, please.
And Pia, do you want to take that?
I'm sorry.
I was asking Dr. Gray if she wanted to answer that question. Otherwise, I'm happy to go. Okay.
Sorry, okay. Yeah, maybe you want to answer it as it relates to mindfulness and so.
Okay. So the D in DBT stands for dialectical. So it's dialectical behavior therapy. And mindfulness is actually a pretty strong component of DBT. And when it comes to whether CBT is effective or DBT is effective, it really depends upon what you're going in there for, and what kind of approach really suits you. I'm more of an expert in CBT. I haven't done much DBT, but there's really this idea that cognitive behavioral therapy is all about changing your distortions, right? All of these statements that we make with ourselves. So if we make one small error, we're like, I'm the worst person in the world. And the question is, are you really the worst person if you've made one mistake? And the answer to that is no. So it's about changing those cognitive distortions. And DBT, especially because it has the mindfulness component, it's considered the third wave of therapy. And the idea is that we work with accepting what's showing up for us as opposed to particularly changing. And it's in this process of acceptance that you end up changing it, but it's a different approach in which you approach that. So it depends upon what exactly you're going in for. And sometimes both of them have actually a lot of good evidence, right? Both CBT as well as DBT have pretty strong support for dealing with emotion regulation. So if that's what you are wanting to go in for, it will depend upon where, if you click with that therapist or not, if you like the approach that they're taking. And so then it becomes more of a matter of personal preference. But I don't know too much about DBT. So if Dr. Gray wants to add in.
Yeah, so DBT was originally created for people with borderline personality disorder. And so it can be really useful. Sometimes people with brain injury groups or other issues might go to these DBT groups or start practicing DBT to help with impulse control, learning how to manage your emotions. So Demas, perhaps that's why you went to that group. As a survivor. It can be very useful. And again, similar to what Dr. Prakash said, there's so many different types of therapies, so many. And so oftentimes it's just how you respond to that particular therapy. And again, your interaction and your relationship with your therapist that often determines your therapeutic outcomes. So, and sometimes, that involves going to different therapists or trying different styles to see what works for you. But again, oftentimes it is personal preference.
Can I add something real quick?
Sure.
All right, thank you. So when I went to DBT, I wish I knew the name of the place. It was out in Dublin. But they actually, the group that I was in, that was facilitated, it was made up of people. It was non-brain injury. I mean, I think I was the only person that may have been in there that was suffered a brain injury. I think it was just a mixture of different people. So I'm getting an understanding that CBT and DBT are two forms of therapies, and one person might respond to one form better than the other. My question is, I just was informed by my caseworker and she told me that Ohio State offers CBT, and I'm not sure if that's accurate or not. She gave me a telephone number, but actually there's someone at Ohio State that this does cognitive behavioral therapy. My question is, number one, is that true? But I'll call and find out. I'll call and find that out if you guys can't tell me that. But also, number two, does Ohio State offer DBT, like a specific person that that teaches people that kind of stuff?
So there are several people throughout Ohio State that offer CBT. So for example, where I'm housed, Department of Psychology, we have a completely free clinic called the Psychological Services Center. And people who run the clinic are people like me, where we run our individual clinics. So I run the mindfulness clinic. We have someone called Dan Strunk. He runs the cognitive behavioral therapy clinic. And then we have Jen Chevins. She runs the DBT clinic. She's actually an expert in doing DBT, but we do have a training model. So it's not the faculty members, it's not the professors who are doing the treatment. We have graduate students in clinical psychology who do the treatment, and we supervise them. So in my clinic, for example, it's the PhD students who are providing treatment, and I provide supervision to them. But that's just one example. And we offer completely free pro bono services, so we don't charge any fee. So what you can expect from that is that our waiting lists tend to be pretty long, but it's worth a call to that. I believe Kedar just sent that in the chat, information for the Psychological Services Center. But I know Dr. Gray and Dr. Wright can speak to a number of services that are offered at the College of Medicine, where we have CBT experts as well as DBT experts.
I'm definitely gonna look into that. I'm already working with Anthea Gray, and she does an awesome job. And I just want to see what else. I want to look into the DBT. I'm just interested in seeing what that can do for me in addition to the CBT. So hopefully the link that was sent will give me a telephone number that I can call tomorrow and try to get linked up with someone. Will that work with what was sent to me?
Yeah, that's good. And oftentimes too, group therapies can also be particularly useful, especially for what you're talking about, because, oftentimes it's very easy to work things out when you're just talking to one other person. But in group therapy, you kind of get to learn how to work things out with different types of personalities, and that's where things get difficult, right? So if you can, I know you said you went to another DBT group in Dublin. Maybe you can, we can talk, maybe there's another DBT group that you might find useful. All right.
Yeah. I know there's also a DBT group, I believe, out in Worthington, too, that does group and individual as well. And I know actually there's a nurse who does it, but I don't think she takes insurance, and I can't recall her name right now. But it's DBT is also good for learning how to tolerate distress tolerance with emotions too. So.
Okay, thanks very much. Thanks, Dimas. That was a good question. Also, I just want to shout out to your beard because it's awesome.
Thank you, brother. I'm trying to keep up with you, man.
All right. Since we're running a little bit low on time, let's see if there's we'll take maybe one or two more questions. Does anybody out there have one? You can raise your hand button or raise your hand or ask a question in the chat. Okay, I'm going to go ahead and ask one more question if I can. So Ryan has a question. Can you please give me a link to watch something about mindfulness? Do we have good resources that are out there? Of course, I know Dr. Prakash's YouTube channel. We will plug that thing as much as we can. But are there other general resources that we should take a look at?
So I think there are tons of books available, right? So John Kabat-Zinn has just this amazing book called Full Catastrophe Living. It's kind of, you know, the guidebook for anyone who wants to get started, but there's a lot of materials on mindfulness. So even if you just go to my lab's YouTube link, just as soon as you click that, on your right-hand side, there's going to be a whole host of other mindfulness channels that are going to show up. So there's no dearth of mindfulness materials. It really is about finding the one that you can connect with and just see what works for you. And I'll send in the name of the book right here.
Okay, we can definitely make that available on the website as well. And just to point out, you know, through Goose Chase, we already have some things that might be helpful for you. We certainly can add more to that in the coming week as well. So take a look for that on the Goose Chase app. All right, I'll ask one more question here. So, you know, we're learning these tactics, you know, of course, you know, things like scheduling and sleep also have you know, have benefits outside of just emotional wellness. And the same probably is true for mindfulness. So I just wanted to maybe ask the panel, as we think about how we notice things in our day, as we deal with the things that we do notice, how might mindfulness help with other dimensions of wellness? So thinking through, and maybe in particular, physical wellness, intellectual wellness, spiritual wellness. What are your thoughts around that?
You know, when I think about this concept of wellness, and I tend to think about it and write about it a fair bit, one of the things that I always like to communicate to whoever is listening is this idea that there are multiple pathways to wellness, right? So I don't want people who are here in this room or in this Zoom, in this virtual room, to leave with this idea that mindfulness is the be all and the end all. It's definitely one pathway to wellness, but if that doesn't work for you, that's totally okay as well. Cannot be easy, and I can tell you from personal experience that when you first get started with these mindfulness practices, you need a lot of social support and scaffolding around this work. And so if mindfulness doesn't work for you, that's totally okay. And then physical activity is another pathway. I always joke with my students that, you know, 20 years from now, we're going to do all of this research and find that the only thing that's really helpful and really needed is social support and social connection. And there's so much literature out. And, you know, when we speak to undergrads, we have to tell them it's not Facebook or Twitter support we're talking about live in person and even these virtual sessions. And that's the reason why social support groups are so effective. So social support is another variable that's extremely effective for overall health and wellness. So there are multiple different pathways and they're all interrelated, right? I tend to do a lot of work on mindfulness, and one thing that mindfulness can help with is just this idea of being open to your experiences. So when we're engaging in exercise, sometimes we're just like, I don't want to be doing that, or that's not for me. But mindfulness really encourages you to be open and curious about whatever experiences you're having. So even if you're not liking it in that moment, let's just be open to that idea and see how that works for you. And we just talked about mindfulness and sleep, you know, this idea that can you just be attending to the present moment without worrying about what you have to do the next day or thinking about what you just did earlier in the day. So I think they're all interrelated, but it's really this idea that there are multiple pathways to it and you can approach it with the way that works best for you. One thing that I would say is that if you are getting started with any new thing, try and find a partner who would do that with you, right? Just having somebody to hold you accountable and to be able to talk to them about those experiences is really effective. So if you're starting a walking program, see if you can get your partner or a neighbor or a friend with 6 foot distance. I feel like I should definitely advocate for that, with 6 foot distance, and then go on that walk that you need to. But just finding somebody to be able to connect to really goes a long way.
And I was just going to add, there are also walking meditations too, or walking mindfulness exercises that you can do. And mindfulness is really a way to also connect yourself to your breath and to your breathing, because sometimes that's all you have time for, is just to breathe. So
Yeah, and to Dr. Prakash's point, yeah, there are a number of ways that you can get centered. That's different for everybody. And sometimes, you know, I work with people and they get so upset with themselves that they can't get mindfulness, they can't do it. So try something else. It's okay. It's okay. So give yourself permission to do that. No matter what therapy, type of therapy you do, what strategy, do what works for you.
Awesome. Well, I think we're a little bit over our time, so I think we'll wrap up. So I just want to plug, again, you know, if you're really interested in mindfulness, Dr. Prakash has this great channel that we linked in the chat, and we can always give you that information again. I want to say thank you to everybody who joined us today and your positive comments about what we're doing here. There's always that survey that we've sent out if you want to see something different or if you really want to see more of what we've got. But this is great. And again, thank you so very much to our presenters, Dr. Anthea Gray, Dr. Ruchika Prakash, Dr. Kathy Wright, for helping us with this. And I will say one last thing, which is we did talk about the research on mindfulness and TBI. And I know that that's why most of us are here, is really about the brain injury side of things. And Dr. Prakash and I, you know, had just a quick exchange today saying, you know, there's just really not a lot of information on this right now. So I'll give a hint, hint, wink, wink to our panelists. We do have those seed grants available in the fall. Maybe this is something that we should be thinking about doing as a university. So hopefully more to come, and maybe there'll be an opportunity for the folks in this chat to be able to participate. So with that, I'll say thank you very much and have a good rest of your evening.